very warm welcome to our esteemed guest, distinguished panelists, and to our valued audience joining us from across the continent of Asia. In a world grappling with antimicrobial resistance and a flood of new diagnostic technologies, the gap between the microbiology lab and the patient's bedside has never been more critical. The question for every healthcare professional is no longer if you need to update your skills, but how you can do it effectively without sacrificing your time. Today, we offer a key to unlocking this challenge. This session is a spotlight on the next strategic advantage, the APSCMI e-learning course on microbiology in clinical practice. This is not just another technical refresher. It is a transformational program designed for one reason: to turn microbiologic data into decisive clinical action. Developed through a powerful collaboration between the Asia Pacific Society of Clinical Microbiology and Infection, or APSCMI, and the bioMérieux Medical Affairs team, this course was built to bridge the gap between the lab and the clinicians. Imagine empowering your team to interpret complex results with confidence, fostering a seamless partnership between microbiologists and clinicians, and directly impacting patient outcomes. That is the power of this program. Over the next hour, we will get straight to the heart of the matter. Our expert panel will tackle the core challenge: why continuous learning in the face of AMR and emerging pathogens is absolutely a non-negotiable for modern clinical practice. Reveal the modern toolkit. Will contrast traditional workshops with the powerful, flexible online tools now available to busy healthcare professionals. Provide an insider's view. You will hear direct feedback on the APSCMI e-learning course from early adopters and leaders who are already using it to elevate their teams. This session is an opportunity to see the future on professional development. Stay with us, engage with our panel, and discover how you can elevate your practice. Let's begin with an opening remarks from Professor Paul TAMBYAH, the immediate past president of the Asia Pacific Society of Clinical Microbiology and Infection.
Good afternoon. As many of you know, for more than 3 decades, the Asia Pacific Society of Clinical Microbiology and Infection has been at the forefront of research, education, and training in clinical microbiology and infectious diseases, first in the Western Pacific and now in the Asia Pacific region. For years, clinical microbiology has been the Cinderella of laboratory sciences, as automation and use of molecular methods have rapidly advanced the fields of clinical chemistry, hematology, and even histopathology. But all that is changing now. With molecular microbiology, diagnostics have improved and patients' care will get even better. Many countries have leapfrogged with technology. For example, in many rural parts of the Asia Pacific and other parts of the world, they did not have landlines, but now everybody is using a smartphone. Similarly, many countries which had limited ability to do cultures and susceptibility testing using conventional, labor-intensive methods are now able to use molecular methods to make accurate diagnoses for their patients with various infectious diseases, to improve targeted therapy and reduce the development of antimicrobial resistance. We have collaborated with bioMérieux in the development of an e-learning course that has been very successful. It has introduced young clinician microbiologists into the various important aspects of clinical microbiology, from sample preparation to data interpretation. Today, we are conducting a stimulus session to disseminate information about this e-learning course so that even more colleagues in the region can benefit. I extend a warm welcome to all of you to today's session, and I hope you will actively participate to gain maximum information about this course and how we can improve the care of our patients through state-of-the-art clinical microbiology. All the very best and enjoy the session.
Thank you, Professor TAMBYAH, for the truly inspiring and powerful message. Your insights have perfectly framed the importance and urgency of our topic today and have set a tone stimulating for the discussion ahead. To formally open our session this afternoon, it is my great honor to introduce Dr. Véronique MOY, Vice President of Global Medical Affairs at bioMérieux. Dr. Moy's leadership and vision are instrumental in driving critical educational initiatives like this one we are discussing today. Her global perspective is invaluable, and we are privileged to have her with us today. Please join me in giving a warm welcome to Dr. Moy for her opening remarks.
Thank you, Helen, for the introduction. So as you understood, I am based in France. You will immediately recognize my French accent, I guess. And I hope that the connection will be fine. If there is anything wrong, Satheesh, do not hesitate to let me know. So bioMérieux is a world leader in the field of in vitro diagnostic, especially around infectious diseases and AMR. And since 1963, the company has greatly contributed to improving public health worldwide. As you know, the field of medicine is constantly evolving. And if we focus on in vitro diagnostics, we have seen major improvement and innovation in the past 10 years. Professor TAMBYAH referred just previously about molecular biology, but more to come about sequencing, for example. It is therefore critical for healthcare professionals to stay up to date and provide the best care to their patients for better outcomes and safety. As part of its public health mission, bioMérieux has always supported high-quality medical education for healthcare professionals. The main goal is to increase knowledge on the critical role played by diagnostic throughout the entire patient pathway, from the diagnosis of a disease to the management. Also increase awareness of global health threats, such as AMR. You are well aware of this issue, especially in ASPAC region. To give access to all our medical education resources, we have created the Medical Education Hub, a platform accessible for free to all healthcare professionals. It is available on biomerieux.com, and if I'm correct, Satheesh will share with you the link so you could just have a look and see all the resources you could discover. We have different approaches for supporting medical education. You know, the independent medical education, when we provide a grant to medical society or CME provider, and the content is developed completely by the organization without any involvement from bioMérieux. We also have bioMérieux provided education. These activities are developed by us, but in collaboration with experts. And we strictly follow the principle of medical education. That means it's really needs-based. We try to identify what are the learning gaps, and this activity are directly developed to address these gaps. We do not include any product, and this is not the goal, to promote our solution. And we try to include the most recent scientific data. And the last approach is collaborative medical education, when we work collaboratively with a medical society, like we have done with APSCMI for the development of the course we are talking today. It has been an honor for bioMérieux to work closely with the Asia-Pacific Society of Clinical Microbiology and Infection on the development of this course. You will hear more detail after, but this course addresses topics on microbiology in clinical practice through a dynamic learning experience, including lecture, video, animation, and interactive activities. Lab professionals, microbiologists, young clinicians who want to strengthen their knowledge in clinical aspects of microbiology would benefit from this course. And as Helen, I said in her introduction, it's critical to build a dialogue between the clinic and the lab. On behalf of bioMérieux, I would like to thank the Asia Pacific Society of Clinical Microbiology and its executive committee for their trust, commitment, and scientific expertise, without which this e-learning would not exist today. I would love to stay with you, but my apologies as I cannot stay longer because I have to leave to the airport. If you have any question, I can take 1 or 2 questions, so feel free to ask. Thank you a lot.
Thank you, Dr. Moy, for that powerful and insightful message. For the audience, if you have any questions, please feel free to type in your questions either in the comments, in the chat box, or the Q&A box. If there are no questions for Dr. Moy, once again, thank you very much, Dr. Moy.
Thank you very much and have a wonderful event.
Thank you. Now, to provide us with a closer look at the resource at the heart of our discussion, I would like to welcome Dr. Satheesh THANGARAJ, Head of Medical Affairs for ASEAN at bioMérieux. Dr. Satheesh has been intimately involved with this project and will now give us a concise overview of the key components of the APSCMI e-learning course. Welcome, Dr. Satheesh.
Thank you, Helen. Very good afternoon, everybody. I'm going to share my screen. Please let me know once you are able to see the slide. Hope we are able to see my screen. Helen, please confirm.
Yes, we can see your screen.
Okay, great. So very good afternoon, everybody, and thanks once again for joining with us. And in next 20 minutes, or probably less than 20 minutes, I'll just take a little bit information about how, what are the structures of this e-learning course and bit update about the participation rate and from the time we launched this course. So the course, what we are talking about is an e-learning course on the topic of microbiology in clinical practice. And later I will give a little bit more information about the options, but currently it is available either through APSCMI or through bioMérieux website. The e-learning course, entire e-learning course was a child of the collaboration between APSCMI and bioMérieux. So the course has 6 modules, and I will just quickly brief a little bit about each course. And then the module 1 is about an introduction. So it takes about 6 minutes for you to complete. It is just to set your expectation and learning objectives about the entire course. And the entire module of module 1 is set with sequence of statements made by the experts like Professor TAMBYAH, Professor David Lai, Dr. Ko, and Dr. TANGARAJ, and they provide what exactly they. And then the actual course or the actual learning experience will start from module 2. So the module 2 is start with the specimens of microbiology, and some probably I need to mention here. The course is not about clear microbiology in practical, which means this course is not really addressing anything how we are processing the specimen. So when we in this module, what we are addressing is how the clinical microbiology specimen collection is unique compared to the rest of specimen collections in the clinical practice. So why it is important and why it is different. So some of these informations are specifically relevant to address some critical clinical questions, and that has to be understood well by both laboratory professional as well as the clinical team as well. So this segment, so this module actually focused on addressing this aspect. So it has 2 segments, and the first segment provides understanding on clinical concept in choosing and collecting right specimen for the right etiology. and why and how the collection has to be done properly. What is a good collection? What probably cannot be considered as a good collection for the corresponding syndrome, what clinically is being diagnosed. So that's what we are trying to address in the module 2. And the second segment is all about how we ensure in the laboratory whether the specimen submitted is good quality in terms of microbiology. So sometimes even the specimen is good quantity and good quality for clinical side, but microbiologically it may have some drawbacks. So that's what we need to ensure at every time when we put a specimen into the clinical microbiology practice, we need to ensure that the specimen is good. So the entire module is through lecture videos, an animated video, and some interactive visuals. Then on the on the module 3, it is about clinical consideration for reporting. Now, in the clinical microbiology, we do not necessarily report in the same way as the other lab medicine departments or lab medicine faculties. So here, sometimes we need to report for some specimen for some patients as soon as possible or 24 hours, and some we don't have to. Some we need to report as quick as possible with the gram smear information, some we don't have to. So this entire module is to address what are the concepts and why it has to be specifically reported on some primary reporting, and then why sometime we need to report for some specimen for some etiology as quick as possible. And then also microbiology reporting is just not one-time affair. It can happen day 1 and day 0 sometime, and day 1 and day 2. So over the period, we accumulate more informations, and then all this accumulated informations are collectively made it as a report and then sent it to the clinical team or provided to the clinical team for their clinical course of action. So this module primarily focus on the concepts and the principles and how exactly this kind of progressive reporting is being managed, and especially just to make sure that people are very clear about emergency versus non-emergency reporting. Again, it may not be very interesting if we have a regular lecture video. So this here we have some interesting learning tools, such as not only the animated video, but also we have some cartoon strip, especially to explain about some case examples. Then the module 4 is more in-depth understanding about pathogen and its identity and the corresponding to the clinical relevance. So it starts with the introduction of fundamentals to consider about the organism identification and ensuring clinically relevant reporting, and also it. Sorry, one second. Sorry. So a clinical and microbiology consideration in reporting. So this is something very important. There are certain reporting we need to consider primarily from the microbiological aspect. However, we always have to consider some clinical aspect as well whenever we prepare the report. So it is not just one report based on our observations. So microbiology is interpretive science. So here, this module goes very deeper into understanding how the pathogen identification is clinically relevant before we report. So again, here we have some interesting tool to learn through the lecture video, animated video, and interpretive visuals. Probably the is the longest one, and this module is about antimicrobial susceptibility testing. So here it has the 7 segment, starting with introduction for guiding the use of AST guided antimicrobial therapy. This is something very crucial, something very unique for clinical bacteriology, especially the antibiotic susceptibility testing and the place it has in the clinical management of patient with infection. So the first one, really the lecture video is really guiding us how the clinical microbiology can effectively be used for antimicrobial prescription. And also, we have so many methods in the modern time, especially. So some can provide some information, some can provide some deeper information, and some can provide some specific information such as antimicrobial resistant genome. So what are the different features and how exactly we can expect for each of this method? And that's what, that is also we go into deeper understanding in this module. And one of the base informations, probably many of you already know that constructing suitable antibiotic panel for AST is one of the complex procedures we probably have to deal. It is also because of the antibiotic availability. It is also because of the organism we encounter, and it is also because of the resistant mechanisms or the frequency of antimicrobial resistance we normally face in our own hospitals. So that's why there is no probably a standard panel. So how exactly we can configure our antibiotic panel to meet the best clinical need of our hospital? And that has also been very well addressed in this module. And then while reporting, AST interpretation is one of the complex thing or one of the crucial information in the clinical bacteriology. So that is also being separately handled in this module for the good understanding of us. And then, the one of the complex thing many times for us to understand, especially for the laboratory people to explain to the clinical colleague, is how certain organisms are relevant for their clinical practice and why some organisms are not. So there are some specific way to look based on the organisms we identify, and also one more layer to add based on the organism isolate from where it has been isolated. So those kind of questions are also being addressed in this module. And then one major connecting component is the collaboration between the microbiology laboratory and the clinical unit. And the better the collaboration constantly, the effectiveness of microbiology can be felt much at a higher level. And that is what is being addressed with the interactive or interview or the conversation between Professor Paul TAMBYAH and Professor TANGARAJ in this video, in this interactive video. And finally, the techniques and technologies in performing AST is also been discussed. Overall, the module is a bit longer, but it is very informative, and it is well constructed through lecture video, animated video, as well as interactive visuals. The final module in this e-learning course it's a bit shorter, but it's one of the critical element in the clinical microbiology. That is how the microbiology data can play a role not only the individual patient management, but overall in clinical practice. So one, practical elements in constructing antibiogram to lead the hospital or the hospital antimicrobial stewardship team to construct their and their antibiogram, and the antimicrobial prescription pattern. And then the second is how we can apply once the antibiogram is constructed, which is the laboratory's duty to make sure that nicely constructed, useful information is available for the clinical colleague. But the duty of the clinical colleague is to apply that information in the clinical practice. So the two videos are actually connected, and they address these two aspects very essentially. So that's overall about the module, the e-learning course itself. So quickly, I will also share some information about how we can access this e-learning course. The channel one is through APSCMI website, and this course, this version is accredited version. So this version is actually through APSCMI. So what are the differences? So when you access the e-learning course through the APSCMI website, you will be asked to do the registration at the host, at the EC generator. And once you have provided your email and then the name, you will be registered, and then you are going to take part in the e-learning course. As mentioned earlier by Veronique, the course is completely free, so you don't have to pay anything here. And then the second option is you can also access the same course. There is actually, in terms of content, there is no difference. But this course is available through the bioMérieux medical education portal. And the only difference is here, you don't have to do any registration. So you can straight away access the course. What are the advantage of having registered? So once it is registered, you are provided with the online certification. So then you will be able to gain. And in some countries later, Dr. Kapading will be able to address a little bit about it. We are also working with the local societies to apply and gain the CPD points at the country level. If that happens, this certification is necessary for you to gain the CPD points. So that can be achieved only through the APSCMI link. But when you are accessing through the bioMérieux education portal, you will be able to have direct access without having without having to provide any personal detail. Now, quickly, I will also share some information from Dr. Simon Pro. He's also from Global Medical Affairs from bioMérieux, and he is following how this this e-learning course is being utilized since its launch. So the launch was achieved almost by end of 2023, which is December 2023. So overall, over 2024 and then the 6 months of 2023, how this e-learning course has been is being experienced with the different people. So as I mentioned, there are two versions. And one is the APSCMI accredited course. So in this accredited module, so far, more than 2,600 learners been completed. So this count is only for the people who completed, who not counting, who just enter and then not completing the course. So, and of course, one of the things we realized is not everybody are taking every single module. So based on their interest, they are taking, so which is also understandable. And some feedback based on the comments they left from in the APSCMI course is also something interesting for me to share here. So one particular comment from the learner is, because it helps me as a clinical microbiologist to improve my skill and knowledge when reporting microbiology results to the clinician and physician. So that's exactly our original or our aim of developing this e-learning course. And there was another comment made by some other participant, and that he or she mentioned, I'm a microbiologist and I need it. Exactly the same. And then in terms of how the learning experience about in participating, one is the entire course is being simplified so that the participant will not get tired of going through the e-learning course. So, and that has been felt by some of the participants. So they left the note saying that nicely explained, easy to follow, and concise facts, easy to understand, structured, and patiently presented. So pertinently presented. And then finally, there are some of the comments highlighting it was very easy to understand due to the simplicity of the explanation, and the course itself does not take too long to finish, while also examining the knowledge you have. So that's something very important. You don't have to go through your testing, but you can, when you go through the e-learning course, you can also understand, okay, this is what I am under the impression, but probably my impression is different than what actually is happening, or what is the new information's been updated, right? So, and also the animations where we spend a lot of time to create are very useful in explaining the concept. So it has been felt by some of the audience or some of the participants, and they highlighted excellent animation and awesome comics. And we have adopted multiple tools in developing the e-learning course, and that has also been highlighted. And one of the things is awareness on pathogen and techniques used in the lab. So that's something we took a lot of time and pain in creating and constructing those kind of information. And we are very happy to realize that that has been felt by some of the audience. No, apart from as a portion of APSCMI course, the accredited course is also available through KSCM, Korean Society of Clinical Microbiology. So later, Dr. Ji-Hye Hong will join from Korea. And so what they did is they translated some of the version, some of the module, or some portion of the modules in the Korean version for the Korean participant to go through. And so using the Korean version, not entirely translated, but some translation been done. So this version gained the attention of 138 completed learners. On the other side, the non-accredited modules since launch have attracted more than 3,000 visitors. And of course, as I mentioned, we will not be able to count, and we will not be able to count the completion rate. What we can count is only the unique hit. And also we will be able to count when you access the learning course through the bioMérieux website. We will be able to monitor how many people are going to APSCMI website and to the accredited as well. And from the non-accredited or the bioMérieux version, we can also understand where exactly people are accessing. So we can see that it is not only in the Asia Pacific. That was our original objective to create this concept, but it has also been accessed from almost everywhere from the globe. And especially for the Asia Pacific, we have participants from India, Pakistan, and Bangladesh, and all over Southeast Asia, ASEAN countries. And so that's the kind of attention we are giving. So quickly, just to make a summary, and this is the team we contributed as a team to create this e-learning course, right from Professor Paul TAMBYAH and Professor David Lea in the leadership, Professor Tan Tien Yen and Professor Katsunori, Professor Koshishan, and Professor Zamperi, and Professor Mina Kim, and Dr. Chu Kalip, who are the expert microbiologists who contributed heavily in creating, and then the whole bioMérieux team. And then the Sal Creative is a team who created the course, the final deliverable. So that's my last slide. And thank you so much for your attention. And back to you, Helen.
Thank you, Dr. Satheesh, for that excellent and detailed walkthrough. Understanding the specific modules and the clinical focus of the course clearly demonstrates the immense value it offers to both clinicians and laboratory professionals seeking to strengthen their expertise. With the strategic vision established by Professor TAMBYAH and Dr. MOY, and the course components clearly outlined by Dr. Satheesh, it is now time to move to the highlight of this afternoon, the panel discussion. We will explore the real-world impact and the pressing need for such educational tools with our distinguished experts. Again, to our audience, if you have any questions, please feel free to put it in the chat box or the Q&A box. It is now my great pleasure to introduce the brilliant minds joining our panel discussion this afternoon. First, please join me in welcoming Dr. James Sim Heng Chak. Dr. Sim is a distinguished consultant microbiologist with deep expertise in next-generation sequencing and diagnostic bacteriology. He honed his advanced skills with a fellowship at Stanford University Medical Center and has held pivotal leadership roles at major Singaporean hospitals, including serving as the chairman of the Pathology Biosafety Committee. His extensive contributions to bacterial diagnostics and laboratory excellence make him a vital voice in our conversation today. Joining him is Dr. Theo Prudencio Yohani Z. Capedi. Dr. Capedi is a dedicated physician and an accomplished public health leader focused on strengthening health systems and advancing healthcare equity. In his roles as the Executive Director of the Philippine Foundation for Equity in Health and as the Secretary General of the Philippine Society of Public Health Physicians, he has been instrumental in developing health programs, especially for geographically isolated and disadvantaged communities. He brings an essential public health and systems level perspective to our discussion. Giving us a glimpse into the future of digital learning, we are thrilled to have Dr. Ji-Hye Hong. As the Medical Director for bioMérieux Korea, she will provide crucial insights on how modern educational tools are being successfully adopted by busy healthcare professionals in Korea, and ensuring we keep our feet firmly planted in the reality of clinical practice across the region. We welcome back Dr. Satheesh THANGARAJ. As the Head of Medical Affairs for ASEAN, he is focused on bridging the knowledge gap where it matters most, in developing countries and in resource-limited settings. With a panel this formidable, our only challenge will be running out of time. A very warm welcome to all of our panelists. Now, let's dive into our first discussion block, the core challenge: why continuous learning is non-negotiable. The central theme for the next few minutes are: what are the key drivers, be it antimicrobial resistance, new diagnostic technologies, or emerging pathogens, that make continuous learning in clinical microbiology absolutely essential for supporting clinical practice today. Dr. James, I'd like to begin with you. From your perspective, can you share why continuous learning in clinical microbiology is critical now more than ever before?
Hi, good afternoon, everyone. Yes, continuous learning is important in any specialty or any fields, particularly microbiology, because our field is advancing so rapidly. I think many of you would have recalled or may have encountered that even one species that Candida species that recognized previously has changed names so many times. In the past, we used to identify organisms using biochemical methods, and subsequently I multi-toph, and even nowadays we have next generation sequencing. So things are moving very fast, and the way knowledge has been coming in is at a rapid rate. Same with antimicrobial resistance. In the past, there are just a few selected mechanisms that we know of, and now there are so many different kinds of antimicrobial resistance. So for us to serve our patients well, and for us to provide the best clinical care to our patients, it is very important for us to be continually updated with latest best practices that is in our medical microbiology. And hence, continuing learning is very important for all of us, not only for the microbiologists, but also for the medical technologists as well.
Thank you, Dr. James. Let's zoom in one of the key drivers you mentioned. How is the ever-evolving challenge of AMR driving the need for both microbiologists and clinicians to constantly update their knowledge about microbes, antibiotics, and the behavior of prescriptions?
That's for me as well.
Yes, if it's okay with you.
Yeah, of course. It's a very loaded question, which I think it will take a very long time to elaborate on this. But can you break it down for me again, such that it is in a piecemeal, such that I can answer one by one?
You mentioned about the ever-evolving challenge of AMR, the fast-paced changes in technology. What do you think is the need that drives both microbiologists and clinicians, wherein they need to constantly update their knowledge in terms of microbiology?
Yes. As I said previously, it's important for us to keep updated with all this latest information, because after all, we are generating reports for our clinicians to make good judgment on how to manage or treat infections in the patients. And without us knowing what is the current literature, it's very hard for us to give a meaningful report, a clinically useful report for our clinicians. And hence, it's important for us who are doing the testing and who is doing the reporting to make sure that our reports are relevant, is up to date to current medical knowledge. And hence, keeping learning is inevitable, and this is a must. It is a must.
Thank you, Dr. James. That clearly highlights the urgency around AMR and what are the needed things to do in order to ensure there's a better outcome for our patients. This leads directly to the technology and the tools we use. The next question is for either Dr. Jihei or Dr. Satheesh. With the advent of multiple diagnostic methods in modern times, like rapid tests and molecular methods, what do you identify as the key knowledge gaps that professionals need to fill?
I propose Dr. Jihe to answer this question, and then I will fill in.
Okay.
So
Jihe,
ladies
please.
first.
Okay. So, in my opinion, understanding the technical aspects of new technology is also a challenge, but rather there is a significant knowledge gap in grasping the clinical relevance of the complex tests performed within the medical laboratory workflow. In particular, less experienced junior staff and medical technologists who primarily work in their specific sections of the laboratory need more practical and holistic education to fully understand the clinical impact of their everyday work.
Thank you, Dr. Jihei. Dr. Satheesh, would you like to add?
Yeah, thank you, Jihe. I think just to take from what Jihe mentioned, these new diagnostic methods in the clinical microbiology are introduced in the last decade, right? So some of these tests are, some of these tests are actually adding value to the existing or traditional method, but some of such testing is actually kind of new. For instance, we never had a concept of AMR gene detection directly from the specimen, but now we have. So this kind of newer layer or additional layer of information need to be carefully analyzed and carefully interpreted, both at the laboratory side as well as at the clinical side. So that really necessitate the additional skill update or learning. So by having more newer diagnostic method, of course, bring a lot of value for the laboratory as well as on the clinical side, but also it comes with some additional newer learning as well. So that has to be emphasized.
Thank you both. That's indeed a crucial point about the gap between the new tools and their practical interpretation. Dr. Yohani, I'd like to get your perspective as a clinician on this. From your point of view, is there a gap in how modern microbiology reports are being interpreted, and how can better informed lab professionals help bridge that communication gap?
Well, I think aside from the skills gap and the knowledge gap, I think what's important for us to understand is in better managing these, for example, multi-drug resistant pathogens, there needs to be a more team-based approach. We need to, our clinicians need to talk to clinical microbiologists more, to lab technicians more, and to truly communicate what do they need in order to correctly analyze or diagnose the patient. So I think these types of capacity building for our lab technicians or microbiologists, and as well as exposing our clinicians to the nuances and the fundamentals of clinical microbiology through this course, I think it enables us to understand each other's perspective more, and it allows us to work together better in terms of team-based approaches to care. So I think for me, that's the most important thing, more than the knowledge or the skill-based gaps that we see right now.
Thank you, Dr. Yohani. That really speaks about the importance of the lab clinician partnership. To zoom out one final time on this segment, but staying with you, how do recent global health events like the COVID-19 pandemic underscore this vital importance of being prepared, collaborative, and continuously learning?
Is this for me also?
Yes, Dr. Yohani.
Yeah, well, we all have experienced that those 2 intensive years, well, 2 or more intensive years of dealing with the COVID-19 pandemic, and just the way that we had to respond to it in a timely manner. It definitely showed us the need for a more a more knowledgeable health workforce. And when I say health workforce, we're now going beyond just clinical microbiologists, but also everyone. Suddenly, even nurses, physicians, suddenly we all need to understand how to handle specimens properly. We need to understand how to do nasal and throat swabs, and that need to adjust our tasks, our roles and responsibilities quickly in that short span of time definitely shows us that there is a need for these types of um, uh, available materials for us to learn from. And in addition to that, I think what is more important is to understand that each clinical laboratory should not think of it should not think of themselves as just an isolated clinical laboratory handling a catchment area. We should think of ourselves as an interconnected node of clinical laboratories. In the future, we need everyone to contribute data, reliable data. We need everyone to know how to promptly report our findings in our own laboratory so that everyone gains from the rapid advance of knowledge or knowledge of these burgeoning outbreaks. So that interconnected nature of our approach and response to future, hopefully not, no, but future antimicrobial resistance um, uh, challenges would definitely need everyone, each laboratory, to be uh, clearly or to be familiar with the fundamentals.
Thank you, Dr. Yohani, for emphasizing that so much needed interconnection and the need to work together. Again, to our panelists, thank you for all those insightful statements. You've clearly established the urgency driven by AMR, the new technologies, and the stark lessons from the pandemic. This sets a perfect foundation for our next segment. We've established why continuous learning is non-negotiable. Now, in our next segment, the toolkit, we'll spend exploring the how. We've established the urgent need, so now let's talk about solutions. What does modern toolkit for upskilling look like? And what are the evolving tools or roles of both traditional methods like workshops and the powerful online tools now available? I'm sorry to be throwing 3 questions at a row at you, Dr. Yohani, but for this segment, I'd like to start with you. For healthcare professionals looking to upgrade their skills, how do you rate or contrast the benefits of traditional learning like workshops and conferences versus modern methods like e-learning courses and podcasts, especially concerning accessibility and flexibility by our busy healthcare professionals?
I'll be very quick then so that everyone has an opportunity to chime in. I think we cannot do without, despite the advances in our modern methods of learning, we can't really do without the traditional methods, especially in terms of developing skills, in terms of learning, getting expert guidance from our more senior colleagues. So that remains an important part of our training and development. But we have seen in the past that, for example, in the Philippines, our national laboratory, the Research Institute for Tropical Medicine, their training wait list is so long at this point. So there is definitely a demand for these types of trainings of upskilling. So we need to develop these new modern methods, like what you said, these online course, these podcasts. And what I think it brings us at this point is the flexibility. We are all inundated with different roles and responsibilities from our different tasks that we have to handle every day. But we need to be conscious about integrating, finding free time to do upskilling, and we can do that through these modern methods. So it's definitely a welcome change, a welcome development. But at the same time, for us, everyone here, there also needs to be a change in mindset, that we have to think about upskilling using these modern methods, not as a one-time event for us, but as a routine, as a thing that we really have to do regularly.
Thank you, Dr. Yuhani. That's a great breakdown of the landscape. Let's dive a little bit deeper into the online tools you mentioned. Dr. Jihei, from your perspective, in a developed country like Korea, how do you see online tools fundamentally facilitating knowledge sharing and collaboration across the healthcare system?
So, like beginning from the COVID-19 experience, the online education tools have become really active, and we have been like learning to be more sophisticated in utilizing it. Like today, depending on the content and the learners who will be taking the learnings, online and offline education are more appropriately selected and utilized. And the greatest advantage is, of course, the convenience of being able to continue learning on demand and regardless of the location. However, I believe even in developed settings, there is an ongoing need for high quality educational content development that is well aligned and verified in its content by experts. And the content has to be made easy to understand through thoughtful use of animated videos and interactive contents. But of course, all of this comes with costs.
Thank you. That's a fascinating insight into an advanced system. Dr. Satheesh, I'd like to pose the same question to you, but from a different perspective. Coming from developing countries' perspective, how do these online tools facilitate the same knowledge sharing and collaboration? And what do you think are the unique challenges or opportunities that they present?
Yeah, thanks, Helen, for the question. Of course, earlier, if you could recollect, Prof. TAMBYAH mentioned, and also Véronique mentioned, that there's a quick escalation of internet activity, especially among developing countries. So from even people don't have the landline, but now everybody have the mobile devices and the internet connectivity is so common. Of course, we don't have to go into the quality of internet, but the availability of internet and the devices is quite widespread. Especially, it is quite useful for our purpose of disseminating this kind of information among healthcare providers in developing countries, right? So yeah, if you look at it, if they had to attend a congress or workshop or a training course, they may have to travel to another city, or they may have to travel to another country, and sometime even from Asia to Europe to attend a big congress, which is not downgraded, but at the same time, the same level of information, the content, the same quality of the content, what Jihei mentioned earlier, is available to the people from the developed countries, and the same content is also now made available to the HCPs in the developing countries almost at the same time. So that's a very impactful dimension we need to think from the developing country point of view. So there is no more excuse, oh, I can't upgrade, or there is no more, kind of, shying away, that such a kind of upgrading myself is not option for me because of some limitation. But now this kind of informations are available through the online tool. So everybody are provided almost the same level of opportunity, whether the HCP is from the developing countries or the developed countries. So the distance or the gap is reduced because of the use of online tools.
Thank you, Dr. Satheesh. It's crucial to understand those different realities. We've heard many benefits of online resources, but with this great power comes the need for caution, as mentioned by Jihei. Dr. James, to round out this segment, what are the general cautions or advice you would give to healthcare professionals when they are navigating the vast world of online educational resources?
Yes, I think the first is to look for reliable sources, like all online content, whether it's videos or information, news. The same applies for online training tools, learning tools. It must be reliable source. And for example, this one provided by APSCMI in collaboration with bioMérieux is a great resource. It's reliable, content is curated and backed by strong evidence. So the first caution is to remind our people who are using this, I'm sorry, that to look for reliable and accredited sources. I'm sorry about that. The second thing that I would like to highlight is that online tools forms part of your learning process. It should not be the only tool. There are many tools to education, and online supplements and covers a gap which sometimes traditional teaching methods will not be able to satisfy. But one should not just rely on online tools alone, but a combination of different educational tools to supplement the learning journey of our lab technologists and microbiologists.
Thank you. So I think that's very clear. Both Dr. Yohani and Dr. James has emphasized that despite the wide availability of online educational resources, this do not actually replace the learnings that we can get from the traditional methods. And I think all of our panelists has also greatly emphasized that for online educational resources, we need to look for reliable or curated resources for it to truly help the professional development of our healthcare professionals. Thank you to the entire panel for navigating the modern learning toolkit so clearly. You've given us a fantastic overview of the spectrum of options from workshops to traditional e-learning and the critical need to be discerning consumers of information. This leads to our next segment where we will put a spotlight on a specific example of these tools. We have discussed the broad toolkit for upskilling. Now, let's zoom in to spotlight and feedback on the APSCMI e-learning course. We want to look at this specific program as a case study. Dr. Satheesh, let's start with the individual user. What kind of professional would you say benefits most from this particular e-learning course? Is it an early career professional, a clinician needing a refresher, or someone in a resource-limited setting?
Oh, thanks for the question, Helen. Of course, some of the points have been addressed earlier by Dr. James and Dr. Kapading also. So I'll just make a quick comment how we anticipated before designing the content. And one of the challenges earlier, we had the conversation with the experts with the APSCMI during the brainstorming session. One thing their advice was carefully avoiding some duplication, something like the techniques and how to process a specimen or how to strain. So which means we have to create a when we ask why such a need, then that something they highlighted a gap in terms of clinical connections between the microbiology and then the clinician. So that's why the our type of audience is also somewhere cross-functional. So in our opinion, following 4 can be a good listed can be, but when I try to look at the profile of the people who are taking the course, I'm seeing 50% our anticipation was right, but no, not always. So in our anticipation, we thought that clinical microbiologist, clinical pathologist, and ID physician who are in their early careers, that's our primary focus, because we want them to understand what are the clinical concepts of microbiology before putting their hand and mind and action in the clinical microbiology lab or in the ward, right? And then, of course, treating physicians probably may not have most updated information about the clinical microbiology. So if they want to particularly address some components, they can always, take advantage of this course. And that's why, we created this module separated so that, they can go through only the module, for instance, AST. So, and then within the AST, they can go through only certain aspects which it is really needed for them. So doesn't necessarily they have to be the early career developer, but they can be physicians who are practicing, but also they just want to understand a little bit better about some of the concepts of clinical microbiology. That also they can, right? And then microbiology need to interact the microbiology lab, whether they are microbiologists or clinical pathologists, doctors, or many times, in our settings, laboratories are primarily driven by the medical laboratories who have to constantly engage conversation with clinicians. They have to provide information and they have to supplement some of the informations where the clinicians take the further steps. So sometimes it is close to the consultation. So they need to be fully aware how exactly things will work. So the technologists who are really playing a crucial role, not only just doing the analysis and also providing the reporting, they need to fully understand why it is important to report in this clinical context. So all these three type of participants can, but also we started realizing some hospitals are using some portion of the content to do their internal training. So they combine this component, for instance, specimen collection. They combine some of the portion of the specimen collection concept in their internal training to coach all their healthcare providers to train them on the proper specimen collection. So that is another dimension originally we never anticipated, but that is also happening.
Thank you. That helps our audience see exactly where this course fits. Dr. James, we are deeply honored to note that you were an early adopter for your staff in bacteriology. As someone who has implemented the course, how do you rate the role of the APSCMI e-learning course in your department?
Yeah, thank you very much. I'll rate it very highly. Otherwise, I won't be an early adopter. Why I would say so is because of many reasons. The first one is save the lab time. Being on an online platform, it takes away some of the time required for training to be online, such that many challenges that the lab face is that we are being so lean now. We just have enough medical technologies to do the work. Sometimes to squeeze in bench work together with training, not only for the trainee, but also for the trainer, can be very taxing. So by taking a part of this training to an online platform where the staff can access it as anywhere, anytime they would like to, actually frees up a lot of time and for our technologists and for our lab. Secondly is the quality of delivery. I think many of us has encountered in our learning journey that different lecturers, though delivering the same content, may have different way of delivering it, such that you learn more better with one lecturer and not so well with another. By having this online platform, the delivery is consistent. It is of good quality, and so the way message is being brought across is the same, regardless of whether it's being learned by trainee A or trainee B, or whether it's being delivered by trainer A or trainer B. Such that everybody learns the same thing, everybody is on the same page, and our practice is consistently standardized throughout. And thirdly, it covers the entire diagnostic cycle of microbiology, from the very beginning of a pre-analytical phase to the analytical phase and the post-analytical phase, how we report, how we generate antibiogram, and how each phase is relevant to the patient and how we take care of the patient. For example, pre-analytical, there's emphasis on the importance of collecting proper samples, because we know it's rubbish in, rubbish out. If you don't collect a good sample, anything downstream is useless. Analytical phase, how we report certain organisms or certain samples, and not all. and how we select the more important organisms to work out. This has twofold benefits. One is for antimicrobial stewardship, because I think many clinicians are not so aware that of the significance of certain reports. So if we report everything, they tend to treat everything. So I think it's important for the lab to recognize what is important clinically and report as such, and not to work out everything and report everything else. And the other good thing is about diagnostic stewardship. I think there's a lot of drive to lower the healthcare costs now, and teaching the technologists and the lab of what is important and what is not, reduce wastage, such that we don't work out on unimportant things and we focus our resources on the important things. Similarly, for the post-analytical phase, I think it's very important as well that the learner appreciates what is being generated, how is it important to the clinician who is reading the report, and also on a broad scale basis, how our data contributes to antimicrobial stewardship as well. So I think I rate this course very highly because it gives a very strong fundamentals for anybody who is stepping into the microbiology lab to cover the phase from right at the beginning, right at the end. And it also serves as a refresher for people, even like me, to be constantly reminded of the importance of each step of the diagnostic process.
Thank you. That's a very powerful message to hear about the real-world feedback. Dr. Jihei, we understand that in addition to the original version, a Korean version of the course was also created. Can you share with us your journey and how are healthcare professionals in Korea using this course to their advantage?
Yes. So last year, Professor Mina Kim, who was the chairperson of Korean Society of Clinical Microbiology, she participated in the production of the APSCMI e-learning course. And afterwards, she mentioned to us, bioMérieux Korea, that the content and the delivery of the final product was excellent, and that it would be great if Korean Society of Clinical Microbiology could also make use of it in Korea. And in doing so, they requested to add Korean subtitles to the videos because in the videos, only the listening of the content could be a little bit harder for the learners. So they requested for Korean subtitles to only the videos. So we, bioMérieux, agreed to assist with that. And after the production of the Korean version, KSCM announced the e-learning to the society members and put a link, like a banner, on the society website and promoted and also promoted the course to the Clinical Microbiology Technologist Society to encourage participation to ultimately enhance understanding of the clinical context of their everyday work.
It's fascinating to see the international adoption. To think about the course of the future evolution of the course, Dr. James, for clinicians updating their skills in infectious diseases or for microbiologists, are there any other topics you would like to propose for future online courses like this?
Yes, certainly. I think before I answer this question, there's one point I forgot to mention why I rate this learning course so highly. It's because it's free and it's available to everybody. I think that's very important, especially for sometimes in private labs like us where we are very tight on finances. I think making it free is a very generous gesture from bioMérieux as well as from APSCMI. And we really appreciate this fact that we make it available for everybody worldwide. As for what I would like to see, I would like to extend this to all aspects of microbiology, not only to bacteriology, but maybe also perhaps extend it to parasitology, mycology, and virology as well. If there's a segment covering things like the other technologies that's commonly used in the laboratory, such as multiplex PCR, and how to properly interpret these results, especially in the clinical setting, In view of how the value of this or the non-value of sometimes this results may be useful for the clinician. It may be also useful for our infectious disease colleagues if we can tie in our results on how to interpret this result and how to extend it to their choice of antimicrobial, including the choice of antimicrobial, the duration, dosages, and so on and so forth. So there are many areas which on my wish list that I hope we can build on this in the future.
Those are indeed wonderful suggestions, and I'm sure Dr. Satheesh and Dr. Jihei will take note of that and see how we can enhance this course in the future. Dr. Yuhani, now that we've heard about the users, the practical application, and the content, I'd like to get the high-level public health perspective from you. What are the motives for an organization like the Philippine Society for Public Health Physicians to disseminate this e-learning course through an accreditation program?
Yeah, that's a good question. And I guess most of our participants here also are wondering why a medical society is here in this conversation. Well, number one, we are the CPD partner of bioMérieux, so that's one thing. But also, we see ourselves more than being just a medical society. We are a community of practice in public health. What that means is we have members who are not just physicians, but also nurses, medical technologists, midwives, and the rest of the professional cadres. And I think in our public health challenges right now, like AMR, emerging outbreaks, we can't have just one professional cadre monopolizing the conversation. So this is where our approach comes in, where we bring in different groups, different people from different backgrounds, and we bring them to work on some public health challenges that we try to identify as priorities. And in terms of these types of partnerships, we hope to bring in more clinical microbiologists as well into that community of practice. As I mentioned before, there is an importance of an intersectoral approach to resolving these AMR challenges or challenges on emerging outbreaks. And we think that if everyone has the same voice, same understanding of the issue, it means for a free-flowing conversation. And we hope that translates also to policy. Now, might be going too far from individual professional upskilling, but basically that's the intent. We hope that having these different groups working together, we can agree on policy recommendations to our national and even international groups, so that we can truly make an impact on trying to resolve these global health challenges. So for us, those are our motives in promoting this course.
Thank you. That really frames the institutional value of everything we have just discussed. Thank you all for that very detailed look at the APSCMI e-learning course. We've covered its value, the ideal user, and practical advice on how to make the most out of it. Once again, thank you, panelists, for such an insightful discussion. Now, we'd like to bring in our audience into the conversation. We have a few more minutes for your questions, and our experts are eager to answer them. I saw one message in the chat that's asking for the link to be shared where they can take the e-course and earn CME credits. I'd like to pass the floor first to Satheesh and then maybe to Dr. Yuhani. There, Satheesh has posted the link where you can access it through the website of APSCMI. And soon, for those in the Philippines, please watch out for the launch by the Philippine Society of Public Health Physicians. And for those watching from Korea, Jihei can also share with you the link of the KSCMI. Okay. For the audience, if there are other questions, please feel free to raise your hand. We'll try to unmute you or place your questions in the chat box or Q&A. I think the discussion was very clear. We've got no questions from the audience. So we move to conclude our session. But before that, I'd like to ask each of our panelists for one final thought to leave with our audience. Dr. James, let's start with you. What is the most crucial piece of advice you would like to share with our audience today?
I think continuing learning is part and parcel of our professional practice, and I think that I want to encourage everybody to continue to pursue continuous learning and pursuit of knowledge in our clinical practice. After all, we are doing this to benefit the lives of our patients, and it's important that we keep abreast with our current medical knowledge. And I'd like to also thank the organizers, APSCMI and bioMérieux, for so generously supporting this online learning tool for all of us worldwide to use, and hope that you can come up with more content in the future. That's all. Thank you very much.
Thank you, Dr. James, for that very important message. Dr. Yuhani, could you share your final thoughts on the importance of investing in continuous education as a fundamental pillar for strengthening public health?
Yeah, so definitely these types of activities are an investment. And I would say that these are investments not just at an individual level, but also at the systems level. Of course, individually, we do understand that taking these types of courses, continuous upskilling of ourselves would lead to career development, professional development. So I hope that everyone comes in to this e-learning course playing a more active role and more conscious role in understanding the content, but also making use of the platform as a place where you can reach out to your fellow clinical microbiologists. Imagine you're consuming the same type of content developed by these world-renowned experts. So this is an opportunity that you can't miss, as well as having to reach out to your co-learners and maybe find some areas of interest that you can work towards. And then at a systems level, I think everyone at the national level agrees on this. These types of public-private cooperation, the development of these materials, as Ji said, it comes with a cost. But now, having developed these e-learning courses, you can share it to everyone. Everyone has access to it. So we are multiplying the impact of these courses. So you're making it's more cost effective now in training our clinical microbiologists, our clinicians, our public health practitioners in these courses. So I guess there is a challenge for all of us here to think about how we can expand our scope and what other technical areas we can develop modules for, so that we can address global health challenges in this coming decade. So again, thanks everyone for your valuable contributions to this e-learning course.
A powerful reminder for our collective responsibility in learning, Dr. Yuhani, for the betterment of our patients and most especially for public health. Thank you. Dr. Satheesh, from your perspective, what makes regional collaborations like this one a successful model for empowering knowledge-sharing efforts across our diverse region?
Yeah, thank you. So this collaboration is between APSCMI, which is the Society of Many Society Association across the region of Asia-Pacific countries, right? So that's something very important. So they know the context of clinical microbiology and infection. And then from the medical affairs of bioMérieux, we collaborated with the APSCMI. Now, what we have realized after collaborating is such a collaboration between organizations, between society and the company is possible to produce a strong outcome. with this kind of e-learning course. Not necessarily it has to be commercially motivated or anything which is centric towards some particular motive, but it is pure for educational purpose. So this is something achievable, but we should not be the only one who can do. So organizations should be encouraged to collaborate, and companies should encourage. And I think Dr. James and Dr. Kapadik mentioned a few times, because making this kind of course available at free of cost is not cheap. So definitely we need the collaboration, and that can make such possibilities happening. So the collaborations are truly essential.
Excellent. Thank you, Dr. Satheesh. And finally, Dr. Jihei, what is your advice for organizations like bioMérieux on fulfilling the responsibility for knowledge dissemination in our field?
Thank you for the question. Well, as you know, bioMérieux is offering solutions across the entire spectrum of infectious disease, from diagnostics and treatment to now expanding our portfolio to surveillance and IT programs, enabling collaborations with a wide range of stakeholders. And we are committed to providing medical education, and we have demonstrated our willingness to invest our resources in doing so. And I believe bioMérieux should continue contributing through collaboration with medical societies. And also from today's talk, I totally agree with Dr. Yohani, the importance of engaging and raising awareness who are also stakeholders in infectious disease. And also with Dr. James, that mentioned also in-depth learnings for healthcare professionals for topics of current interest. And I hope bioMérieux will continue in working in this field.
What an incredible way to conclude our discussion. Once again, a huge and sincere thank you to our panelists, Dr. James, Dr. Yohani, Dr. Jihei, and Dr. Satheesh, for sharing your invaluable time and wisdom with us. Over the past hour, we've journeyed from the urgent why to the practical how. We did not just talk about the challenges facing clinical microbiology. We also illuminated a clear and accessible path forward. Today was all about empowerment. It's about showing that we have the tools to stay ahead of antimicrobial resistance, to master the new technologies, and to strengthen the partnership not only between laboratory and clinicians, but between organizations and medical societies. The APSCMI e-learning course is more than just a program. It's a direct response to the needs that we have discussed today. Investing in our knowledge is the single most powerful investment we can make in our career, and most importantly, in the future of patient care. This is our opportunity to take the next step. We warmly invite you to explore the course, see how it aligns with your professional goals, and join a growing community of healthcare professionals dedicated to making a difference. Thank you all for your time and for being part of this vital conversation. Have a wonderful afternoon, everyone. Thank you.
Thank you.
Thank you.
Thank you.
Bye-bye.